Hello everyone. Today's video is another Q&A about methylene blue. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if you wouldn't mind taking a moment at some point to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. Lots and lots of questions about methylene blue as always, so I'm gonna dive right in here. So question here about can methylene blue be taken if a person has hyperthyroidism? So I'm not aware of any contraindications, or innate contraindications, if a patient has hyperthyroidism or hypothyroidism for that matter, in taking methylene blue. So the main, just as a little recap, is that some of the main concerns or cautions with taking methylene blue are if patients taking, or if an individual is taking something that boosts up their serotonin levels, so supplements like 5-HTP, St. John's wort, possibly melatonin, and then different drugs that boost up serotonin. So that would include SSRI drugs, like Prozac, for example, tricyclic antidepressants like amitriptyline, which are sometimes taken for non-depression reasons, SNRI slash reuptake inhibitors as well. So various drugs that can do that. So there's also certain kind of miscellaneous drugs that sometimes boost up serotonin, so we have to be cautious with those. And then also any drugs that also inhibit monoamine oxidase. So these MAOI drugs, we have to be cautious with those too, because methylene blue rather seems to have this mild MAO inhibition effect. So it has this mild MAOI effect as well. Also have to be a bit careful with foods that are high in tyramine. And then potentially if an individual has something called a glucose 6-phosphate dehydrogenase deficiency, might have to be a bit careful with methylene blue in that case as well. So those are really the main major concerns or potential concerns to my understanding. Again, not giving any medical advice, just saying this for informational purposes, academic purposes. So kind of based on that list, it's there's no innate concern necessarily with hyperthyroidism, hypothyroidism, or medications one might take along with that. Now, have they done studies showing if I take methylene blue at the exact same time as my Synthroid, is that okay? I don't think anybody's ever studied that. I don't imagine they ever will study that. So, there might be some concerns about taking methylene blue at the same time as certain medications. So that would be something, of course, to talk to your healthcare provider to get some specific advice around that if you have questions about that. All right, the next one here is about taking muscle relaxants alongside methylene blue. So kind of same answer, that I'm not aware of any direct sort of contraindications with taking methylene blue alongside muscle relaxants. Now, can they be taken at the exact same time? That's something, again, getting individualized advice on that, and that is my what I will say about all the questions that are in here about taking different medications. There's another one here saying thoughts about using methylene blue if a person has high blood pressure and is taking blood pressure medication. So with methylene blue, the one thing that I didn't mention is that because it does have that MAOI inhibition effect, my understanding, and I've never seen this in any of my patients, but this is something that is talked about, so something that's worth mentioning here, is that some individuals evidently do report having a transient mild increase in their blood pressure when they first start taking methylene blue, and then that they evidently adapt to that and it goes away. So I haven't seen that in any of my patients. I forewarn them about that before putting them on methylene blue, just to watch out for that. But I haven't actually seen that in practice. So, in terms of, taking a blood pressure medication, the one specifically asked about here is called lisinopril. To my understanding, there's no direct, contraindication to taking methylene blue alongside, I'll just say alongside lisinopril. Again, not saying it's okay to take it at the exact same time, because no research looking at that, to my understanding. But in terms of would there be any contraindication with high blood pressure, it's if I had a patient who came in and they had really, really high blood pressure, 200 over 120 or something like that, it's oh man, methylene blue would not be the first thing I'd be thinking of. The first thing I'd be thinking of is man, oh man, you need to go get on some blood pressure medication to lower that down, would be my first thought. That would not be something that I would be managing in my office, because I'm not an emergency room doctor. But so that would be the only kind of high blood pressure case where I might think like, oh wow, if it's already like super high, then even if there was a transient mild increase, like we would not want to risk that. But anyways, I'll leave it there for now with that particular one. Next one here says, can methylene blue create an environment which benefits gram-negative bacteria? Example, suspected brucellosis while on 100 milligrams daily of methylene blue. Good question. I don't think so. I mean, to be honest, can't really, when I saw this question, I was thinking, well, I can't really think of any reason why like we'd really care about the gram positive or negative status of the bacteria as it relates to methylene blue. If the person asking the question or anybody else listening has any insight on like why that might matter, I'd be curious to know. I mean, yeah, I'm not really sure why it would matter if they're gram positive, gram negative. 100 milligrams per day of methylene blue is a fairly high dose. It's debatable as to whether that would be at an oxidative dose or not, where it might actually help to kill off microbes. So could potentially be antimicrobial, kind of depend on the body weight of the individual in question, and maybe some other individualized factors. But I can't really think of any reason why it would benefit a gram-negative bacteria. So if the person asking the question wants to post in the comment section, like why you think it might benefit them, I'd be happy to, answer the question if I can, but I can't think of any reason why it would benefit a gram-negative bacteria. Let's see here. Question about taking methylene blue while working with chemotherapy. So I work with a lot of patients with a cancer diagnosis. Many of them are using chemotherapy while they're working with me. The one thing that we tend to be, I say we, and I guess in more of the royal sense, that I tend to be more cautious with when it comes to patients who are on chemotherapy. Well, quite frankly, I tend to be cautious with a lot of things when patients are on chemotherapy. One of the things that I'm very, very cautious with, though, is antioxidants, because by and large, most chemotherapy agents, really all chemotherapy agents, and bearing in mind I'm talking about chemotherapy, not immunotherapies, which can work through different mechanisms. But when it comes to chemotherapy, it's really working to induce oxidative damage against the cancer cells. So we have to be really, really cautious when it comes to using antioxidants, because we don't want to neutralize the effects of that chemotherapy. Now, what's interesting is that when they have done human clinical trials on a variety of different substances that are antioxidants or have antioxidant properties like melatonin or curcumin, a little bit of some limited research on quercetin, frankincense, agents that have known antioxidant properties to them. By and large, those studies, whether it's in humans, petri dishes, animals, they generally show a synergy between the chemotherapy agent and the antioxidant substance. So there's more to the story, I think, than just like, oh, antioxidants and chemo don't mix. But with something like methylene blue, where it's a really, really, really strong antioxidant, I personally would not recommend that to one of my patients who's working with chemotherapy, because I really would be concerned it might neutralize it. So until they come out with some human clinical trials showing it's a good idea to combine it, that would be one that I would not combine at the same time personally in my practice. All right, let's see here. So a question about taking methylene blue and ashwagandha and selenium. So no interactions with that I'm aware of with either of those. And then another question asking about methylene blue being combined with magnesium, vitamin C, B12, vitamin D3/K2, zinc, maca, and a plant that I've never heard of, turkesterone. I'm not so sure about that one, but not aware of any interactions with any of those substances. Again, just saying all that academically, not giving anybody advice. Let's see here. So question about would huperzine A be included? That is a really good question. I know huperzine A has been shown to help improve acetylcholine levels. To be honest, I never prescribe huperzine A, so I'd have to double check on that, whether or not it actually has been ever shown to boost up serotonin. So I'm not sure on that one. That's a really good one. And then a question about Adderall, and I'm not aware of that having an interaction either. So thank you for the questions as always. Always happy to talk about methylene blue. Any other questions, just post in the comment section below and I will do my best to answer as soon as I can.